Hickox fought back and will be quarantined at home. Others might not have that choice. Rosa Flores, CNN, New York.
All right, joining with me now is Dr. Devi Nampio-Parempo of the NYU School of Medicine, also Dr. Gregory Ciottone of Beth Israel Deaconess Medical Center and Harvard Medical School. Back with me, of course, our very own Dr. Sanjay Gupta. Dr. Devi first. Well, Sanjay, I should say. Let's start with you. Should we have a set federal guidelines that every state follows so that there is a clear policy here?
I think that would probably be a good thing, and the CDC does make guidelines and recommendations, but that's all they are. They're not enforceable. There's no mandates around that. But look, people, this is confusing. One state's treating something differently than another state. If you're sort of tuning in and out of this, you think, well, what's the right answer here? Is there a right answer? And obviously pathogens, they don't respect borders. People can cross from one state over to the other. So what happens if you're a resident of New Jersey and you go to Idaho? Are you gonna be under New Jersey's sort of rules or Idaho's rules? I think it gets confusing.
Then what should that be then, Dr. Gupta, so that everyone is sort of on the same page? And because New Jersey has one, New York has another, South Carolina has another. What should they be? What should those guidelines be?
Well, I think the science really does matter here, and you don't want to be dismissive of the fear around this, but I think the science matters. The Doctors Without Borders, for example, have been doing this sort of work for decades in West Africa, and they have very clear guidelines here. These are not equivocal. One of the things they say is that quarantine is neither recommended nor warranted. Now, obviously, the CDC has gone a little bit further than that, saying let's stratify people into high risk all the way down to no risk groups. And based on that is going to basically give you your level of how closely someone should be monitored. But they also say unless you are symptomatic, you don't specifically get quarantined. You may limit your public activity, you may not travel as much if you're in the high-risk group, but you're not quarantined. Those seem like pretty good rules based on real science and experience.
So then what about this Casey Hickox, this nurse that was released from the University Hospital in Newark today? And she was privately transported back to her home in Maine. She says she never had a fever, doctors, or symptom. So was this all an overreaction? Dr. Devi, to Sanjay's point, if you don't have any symptoms and you're not showing any signs, then you should not be under, sort of a very stringent isolation sort of quarantine.
Well, I think there are a couple of different things to consider. So in terms of whether she was infectious, whether she could get other people sick without a fever, the answer is no. But should we look at this quarantine in terms of, the public's concerns, protecting the public? And I think what we learned from Dr. Spencer is that, he followed the guidelines that he was given. There wasn't very clear instruction. But if he had had symptoms, then it could have, potentially spread through the subway, when he had symptoms, not beforehand. Yeah. But here in Casey Hickox's situation, I feel bad for her. She got a raw deal, but I think it could have gone very differently if people approached her and asked her to voluntarily quarantine herself. If she was greeted by people who said, you've been out of the loop for a while, but let's bring you up to speed on what's going on. Significant concern.
It seems like Dr. Ciottone is sitting there raring to get in because Dr. Ciottone, I think you think that there should be some self-isolation, some sort of quarantine when workers come back, correct? Is this an overabundance of caution, you think?
No, I don't think so. And in her case in particular, I can understand the concern. I mean, at one point she apparently had a fever. Now, whether she did or she didn't, we can argue, and she probably in fact didn't. But when you combine what she had done the last several weeks with now she has a fever, I understand the concern and why immediately she was isolated. Now, you know my stance on this. We talked about this last hour, but I think that yes, we do need to have a strict quarantine for those healthcare workers who returned from West Africa, because I'm not convinced that the personal protective equipment is doing the job it should be doing, whether it's putting it on, taking it off, etc., because there are healthcare workers getting sick. However, at the same time, I think we need to demystify quarantine. And this is my concern I had with what the CDC said today about when people come back as heroes from treating Ebola patients in West Africa, which they absolutely are, we don't want to turn them into pariahs. Well, my response to that is quarantine is not turning somebody into a pariah. The CDC knows better than anybody the role that quarantine can play in outbreaks and preventing epidemics. And this is not, as your earlier piece showed, this is not the first time the U.S. has dabbled in quarantine. And we first did it in the 1600s for smallpox. We did it more recently with the gentleman who had multi-drug resistant tuberculosis and was flying back and forth. So we've dealt with quarantine in the past, and it doesn't have to be, it can be in your home, it can be very comfortable.
All right. Thank you very much, Dr. Ciottone, Dr. Devi, and as always, Dr. Sanjay Gupta. When we come right back, Newt Gingrich